Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
This national and community message that it's okay to need help and it's okay to get help, and help's easily available.
A new, easy-to-remember number, 988, is now available to connect people in a mental health crisis to help and hope. The National Suicide and Crisis Lifeline just rolled out and has already seen an increase in calls and messages. There are more than 160 call centers throughout the U.S. Lines for Life is the home of 988 Oregon, taking most calls and texts from Oregon area codes. Dwight Holton is the CEO.
When you call 988 or any of our crisis lines, what you'll find is a compassionate person on the other line, trained professional, ready to listen, ready to help connect you to resources to help you find a way forward. But really, above all, it's about active and effective listening.
988 is a resource for folks going through a range of mental health struggles. Maybe you're having a hard day and don't know how to talk to the people in your life about that anxiety or sadness. It's also there for people in crisis who are thinking about harming themselves or others. No matter what you're going through, Holton says when you call 988, you can expect the same type of care and compassion with one big focus: hope.
Well, it's funny, we think about hope as kind of a Hallmark card sentiment, right? A greeting card sentiment. But in my world, hope is an evidence-based strategy. And it's one that the amazing crisis intervention specialists at Lines for Life are able to put to use every day to help people who are calling on their very worst day, in their very worst moment, find a way forward, find hope, find connection, and come back to the community.
Holton hopes 988 will transform and improve crisis response nationwide. He says while the majority of the calls and texts that come through Lines for Life are resolved over the phone, 988 will grow mobile response teams, taking the burden off 911 dispatch. That, he says, creates an opportunity to bridge the gap for mental health care in marginalized communities.
One of the real opportunities here is to reach communities that have been left behind, both in mental health work, but also in some of the other work we've done in reaching people in crisis. There are communities of color, in particular in Oregon, where calling 911 doesn't really feel like a great option.
Holton says not only does this offer quick access to help, it sends a message that it's okay to get help and you're not alone.
Just the message that it sends for the nation to be adopting a national mental health crisis line. It's a way of coming together as a community, as a state, as a nation, and saying, hey, we get it. It's okay to struggle. We all struggle from time to time. And importantly, it's okay to get help, and help works.
If you or someone you know is struggling, that compassionate professional care is available 24/7 by calling 988. We also have more Lines for Life resources for you at kgw.com. Just click on the Healthier Together tab. We'll bring you a new Healthier Together segment each week. Next time, we're talking with the Oregon Health Authority about their Rethink the Drink campaign for alcohol consumption awareness.